Welcome. Today, we're diving into the world of hives, also known as urticaria. Hives are those itchy, red welts that can suddenly appear on your skin, often causing discomfort and concern. But what actually triggers these outbreaks? In this video, we'll explore the most common causes behind hives, helping you understand what might be affecting your skin. Whether you've experienced hives yourself or are just curious, this guide will break down the triggers, from foods to environmental factors, and more. Let's start by understanding what hives are and why they happen. Hives, or urticaria, are raised, itchy bumps that can appear anywhere on the body. They often vary in size and shape, and may join together to form larger patches. Hives are usually a result of the body's immune response, releasing histamine and other chemicals into the skin. This causes blood vessels to leak, leading to swelling and redness. Hives can last for a few hours or even days, and sometimes they come and go without any clear reason. Understanding the underlying triggers is key to managing and preventing future outbreaks. Hives can be classified as acute or chronic. Acute hives last less than 6 weeks and are often linked to specific triggers, while chronic hives persist for more than 6 weeks and may not have an obvious cause. Acute hives are more common and usually resolve once the trigger is removed. Chronic hives can be more challenging, sometimes related to autoimmune issues or ongoing exposure to a trigger. Knowing the difference helps in identifying the cause and choosing the right treatment approach. One of the most common triggers for hives is food allergies. Certain foods can cause the immune system to react, releasing histamine and resulting in hives. Common culprits include nuts, shellfish, eggs, milk, and strawberries. Sometimes even food additives or preservatives can provoke a reaction. If you notice hives after eating a particular food, it's important to identify and avoid that trigger. Keeping a food diary can help track down the source and prevent future outbreaks. Medications are another frequent cause of hives. Antibiotics like penicillin, pain relievers such as aspirin or ibuprofen, and certain blood pressure medications can all trigger allergic reactions in some people. The body may see the drug as a threat, leading to the release of histamine and the appearance of hives. If you suspect a medication is causing your hives, consult your healthcare provider before stopping or changing any prescribed drugs. Infections, both viral and bacterial, can sometimes trigger hives. Common illnesses like the common cold, flu, or even urinary tract infections may prompt the immune system to react, resulting in hives. Children are especially prone to developing hives during or after an infection. In these cases, hives usually resolve as the infection clears up. If hives persist or are accompanied by other symptoms, it's important to seek medical advice. Environmental allergens are another significant trigger for hives. Pollen, pet dander, dust mites, and mold are common culprits. When sensitive individuals come into contact with these allergens, their immune system may overreact, leading to hives. Seasonal changes often bring an increase in pollen, which can worsen symptoms for those with allergies. Minimizing exposure to known allergens and keeping indoor environments clean can help reduce the risk of outbreaks. Physical triggers can also cause hives in some people. These include pressure on the skin, scratching, extreme temperatures, sunlight, or even exercise. For example, wearing tight clothing or carrying a heavy bag can lead to pressure-induced hives. Cold-induced hives may appear after exposure to chilly air or water, while heat or sweating can also be a factor. Recognizing these physical triggers can help you take steps to avoid them and manage your symptoms. Believe it or not, emotional stress can play a role in triggering hives. When you're anxious, nervous, or under pressure, your body releases stress hormones that can affect your immune system. This may lead to the development of hives, especially in people who are already prone to skin reactions. Practicing stress management techniques, such as deep breathing, meditation, or regular exercise, can help reduce the likelihood of stress-induced hives. Direct contact with certain substances can also cause hives. Common contact allergens include latex, certain plants like poison ivy, chemicals in cleaning products, and even some cosmetics or fragrances. The skin reacts to these substances by developing itchy, red welts. If you notice hives after touching a specific item, try to avoid further contact and consider using protective gloves or switching to hypoallergenic products. Insect stings and bites are well-known triggers for hives, especially in people who are allergic to insect venom. Mosquitoes, bees, wasps, and ants can all cause localized or widespread hives. The body's immune response to the venom or saliva leads to swelling, redness, and itching. If you experience severe reactions, such as difficulty breathing or swelling of the face and throat, seek emergency medical attention immediately. Sometimes, hives can occur without any identifiable cause. This is known as chronic idiopathic urticaria. People with this condition experience hives regularly for months or even years, and despite thorough testing, no specific trigger is found. It can be frustrating, but treatments are available to help manage symptoms. Antihistamines and other medications can provide relief, and working with a healthcare provider is essential for ongoing management. In some cases, hives are linked to autoimmune conditions. The immune system mistakenly attacks the body's own tissues, leading to chronic inflammation and hives. Conditions like lupus, thyroid disease, or rheumatoid arthritis can be associated with this type of urticaria. If you have a known autoimmune disorder and develop hives, it's important to discuss this with your doctor, as it may influence your treatment plan. Both hot and cold temperatures can trigger hives in sensitive individuals. Cold urticaria occurs after exposure to cold air, water, or objects, while heat urticaria can develop after hot showers, baths, or exercise. These reactions are usually immediate and can be prevented by avoiding sudden temperature changes or protecting the skin with appropriate clothing. Exercise can sometimes trigger hives, especially in people with a condition called exercise-induced urticaria. Physical activity raises body temperature and increases blood flow, which can lead to the release of histamine and the appearance of hives. In rare cases, this can progress to a more serious reaction called exercise-induced anaphylaxis. If you notice hives during or after exercise, consult your doctor for advice on safe activity levels. Pressure on the skin, such as from tight clothing, belts, or carrying heavy objects, can cause a type of hives known as pressure urticaria. The affected area may swell and become red and itchy, often several hours after the pressure is applied. Wearing loose-fitting clothes and avoiding prolonged pressure can help prevent this type of reaction. Some people develop hives after exposure to sunlight, a condition known as solar urticaria. This rare type of hives appears within minutes of sun exposure and can affect any area of skin that's not covered by clothing. Wearing protective clothing, using sunscreen, and seeking shade are effective ways to prevent solar urticaria. Water-induced hives, or aquagenic urticaria, are extremely rare. In this condition, contact with water of any temperature can cause hives to develop. The reaction is not related to water purity or temperature, but rather the skin's response to water itself. Managing this condition involves minimizing water exposure and using protective creams or medications as recommended by a healthcare provider. Vibration-induced hives, or vibratory urticaria, occur after exposure to vibration, such as from using power tools or riding in a vehicle. The skin develops red, swollen patches at the site of vibration. This rare form of hives can be managed by avoiding or limiting exposure to strong vibrations and using antihistamines if needed. Hormonal changes, such as those occurring during pregnancy, menstruation, or menopause, can sometimes trigger hives. Fluctuations in hormone levels may affect the immune system and skin sensitivity. If you notice a pattern of hives related to hormonal cycles, discuss this with your healthcare provider for tailored advice and management. Alcohol consumption can sometimes trigger hives, either due to an allergic reaction to ingredients in alcoholic beverages or as a result of alcohol's effect on blood vessels and the immune system. Some people may react to specific types of alcohol, such as wine or beer, while others are sensitive to additives or preservatives. If you notice hives after drinking, try to identify the specific trigger and limit your intake. Certain food additives and preservatives, such as artificial colors, flavors, and sulfites, can trigger hives in sensitive individuals. These substances are commonly found in processed foods, soft drinks, and packaged snacks. Reading ingredient labels and choosing fresh, whole foods can help reduce the risk of hives caused by additives. Latex, found in gloves, balloons, and some medical devices, is a common contact allergen that can cause hives. People with latex allergy may also react to certain fruits like bananas, avocados, or kiwis due to cross-reactivity. If you suspect a latex allergy, avoid latex-containing products and inform healthcare providers of your sensitivity. Pet dander, which consists of tiny flakes of skin shed by animals, is a common allergen that can trigger hives. Cats and dogs are the most frequent sources, but any furry animal can be a culprit. Regular cleaning, using air purifiers, and limiting contact with pets can help reduce exposure and minimize hives. Mold spores in the environment can act as allergens and trigger hives in sensitive individuals. Mold is commonly found in damp areas like bathrooms, basements, and kitchens. Reducing indoor humidity, fixing leaks, and cleaning moldy surfaces can help prevent hives related to mold exposure. Dust mites are microscopic creatures that live in household dust and can trigger allergic reactions, including hives. They thrive in bedding, upholstered furniture, and carpets. Regular washing of bedding in hot water, using allergen-proof covers, and vacuuming can help reduce dust mite exposure. Pollen from trees, grasses, and weeds is a common environmental allergen that can trigger hives, especially during certain seasons. Keeping windows closed, using air conditioning, and showering after outdoor activities can help minimize pollen exposure and reduce the risk of hives. Exposure to certain chemicals, such as cleaning agents, detergents, or industrial chemicals, can irritate the skin and trigger hives. Wearing gloves, using mild products, and ensuring good ventilation can help protect your skin from chemical-induced hives. Some cosmetic products, including lotions, creams, perfumes, and makeup, contain ingredients that can trigger hives in sensitive individuals. Fragrances and preservatives are common offenders. Opting for fragrance-free and hypoallergenic products can help reduce the risk of cosmetic-induced hives. Fragrances in perfumes, soaps, and personal care products can cause skin irritation and hives in some people. These reactions may be immediate or develop after repeated exposure. Choosing unscented or fragrance-free products is a good way to prevent fragrance-induced hives. Contact with certain plants, such as poison ivy, poison oak, or stinging nettle, can cause hives and other skin reactions. Wearing protective clothing and learning to identify these plants can help you avoid accidental exposure and prevent plant-induced hives. Eating very hot or cold foods can sometimes trigger hives, especially in people with temperature-sensitive urticaria. Ice cream, hot soup, or spicy foods may provoke a reaction. If you notice a pattern, try to avoid extreme food temperatures and opt for moderate options. Some people develop hives only when they exercise after eating certain foods, a condition known as food-dependent, exercise-induced anaphylaxis. Common triggers include wheat, shellfish, or nuts. Avoiding exercise for several hours after eating trigger foods can help prevent this type of reaction. Salicylates are naturally occurring chemicals found in some fruits, vegetables, and medications like aspirin. Some people are sensitive to salicylates and may develop hives after exposure. If you suspect salicylate sensitivity, consult your doctor for guidance on dietary and medication choices. Artificial color additives in foods, drinks, and medications can sometimes trigger hives in sensitive individuals. These additives are often found in candies, soft drinks, and processed snacks. Reading labels and choosing products without artificial colors can help reduce the risk. Some medications contain preservatives that can trigger hives in sensitive people. These include certain injectable drugs, eye drops, and vaccines. If you have a history of reactions to preservatives, inform your healthcare provider before receiving new medications. Although rare, blood transfusions can sometimes trigger hives as an allergic reaction to proteins or preservatives in the donated blood. Medical staff monitor for these reactions and can provide treatment if hives develop during or after a transfusion. Vaccinations can occasionally cause hives as a side effect, usually due to an allergic reaction to vaccine components, such as gelatin, egg protein, or preservatives. These reactions are rare, and medical staff are prepared to manage them if they occur. Always inform your provider about any allergies before receiving a vaccine. Certain underlying health conditions, such as thyroid disorders, hepatitis, or cancer, can sometimes be associated with chronic hives. In these cases, treating the underlying condition may help resolve the hives. If you have persistent hives, your doctor may recommend screening for these conditions. Genetics can play a role in the development of hives. Some people inherit a tendency to develop allergies or have family members with similar conditions. While you can't change your genes, being aware of your family history can help you and your doctor anticipate and manage potential triggers. To sum up, hives can be triggered by a wide range of factors, including foods, medications, infections, environmental allergens, physical stimuli, and even stress. Understanding your personal triggers is key to managing and preventing outbreaks. Keeping a symptom diary and working with your healthcare provider can help you identify patterns and develop an effective management plan. Most cases of hives are mild and resolve on their own, but sometimes they can signal a more serious allergic reaction called anaphylaxis. If you experience difficulty breathing, swelling of the face or throat, or dizziness, seek emergency medical attention immediately. Your doctor can also help if hives are persistent, severe, or affecting your quality of life. Managing hives involves identifying and avoiding triggers, using antihistamines or other medications as prescribed, and practicing good skin care. Keeping your skin cool, avoiding scratching, and wearing loose clothing can help relieve symptoms. For chronic or severe cases, your doctor may recommend additional treatments or refer you to a specialist. Living with hives can be challenging, but understanding your triggers and having a management plan can make a big difference. Support from family, friends, and healthcare providers is important. Remember, most cases of hives are temporary and manageable with the right approach. Stay informed, be proactive, and take care of your skin. In conclusion, hives are a common skin condition with a wide variety of triggers. By learning about the most common causes and how to manage them, you can take control of your symptoms and improve your quality of life. If you have concerns about hives or experience severe reactions, always consult a healthcare professional. Thanks for watching, and take care of your skin.